Welcome back, everybody. On the Health Watch this morning, we're looking into new technology that can check your skin for cancer and other issues. There are so many devices and apps that use AI now to see if anything looks suspicious. So, is this health or hype? Dr. Matthew Knight, oh, that all rhymed, is here to separate health from hype. He is the president of Knight Dermatology Institute. He's also a member of the Florida Board of Medicine. It's always good to see you, friend.
Great,
How
thanks
are you?
again. Great.
So let's talk about it. So what are these? These are like AI skin apps that people can download?
So for the first time, I'm going to have my phone in my hand while I do a segment. But yeah, so it's an AI app. You download them. There's hundreds of them all over the internet. And you take a bunch of selfies of yourself, and then it's going to spit out a score, a redness score, a pore size score, how much photo damage you had, and then give you this aggregate score. And of course, most of these apps are going to try to sell you something on the back end, and that's a common theme we keep talking about, is a lot of this online stuff, it's either free or freemium, because it's trying to sell you stuff. Freemium, isn't that a great term?
Trial, and then it's charged.
Then it's charged. And in this case, it's charged. They're either going to link you to some influencer, or they're going to try to sell you some cream. But people really love this stuff because it's tailored to them. It makes you feel like somebody's really paying attention to your skin. But I think we need to take it with a big grain of salt.
And so you download this, and so what are people doing with this?
Yeah, well, so they're taking the pictures, and it's important to remember that it's just a 2D picture. So it's not like me looking at you right now. It's just a picture. And pictures are great for memories and things, but they're really not great to glean a bunch of stuff about your skin, because it's very sensitive to lighting and focus and angle. And you know, if you're a dermatologist like me, people send you pictures all the time of stuff, and it looks like the Loch Ness Monster, like Sasquatch. It's all blurry and you can't tell. Very, very hard to tell stuff from two-dimensional images. But that's what these AI algorithms are meant to do, is to extract something from a two-dimensional photograph and give you a skin score that then, of course, they're going to try to sell you a product on the back end of that.
So the bottom line is this health or hype? Because it sounds, and correct me if I'm wrong, that a lot of this is really just for cosmetic purposes. Not necessarily for like detecting cancer, which you definitely would not want to do.
Yeah, there's two sides to this. One thing, you know, a couple of years ago, if I opened up Instagram, there were companies that were pushing games to dermatologists, like spot this rash or name this whatever. What they were trying to do was train their AI algorithms on how to do this sort of thing. And so here we are a couple of years later, where we've got these apps saying that they can diagnose skin things. And I think if you're trying to pick out a makeup, it might be a great idea. But to your point, if you're trying to use it to detect skin cancer, that needs to be done in 3 dimensions under really good lighting, and you need a biopsy if there's a concern for cancer, not an AI app.
Very quickly, do people know this? Do the people who are doing this know this, though?
You know, I think they do a little bit. I mean, any of us who've used AI know that it hallucinates all the time and it gets stuff wrong. A bigger issue here are young girls that are using this, and it's spitting out some skin score saying that there's something wrong with their skin because it's trying to push a product, and in reality they have beautiful skin. So I worry about the body dysmorphia of all of that. But you know, I think most people understand that this kind of stuff is fun. It's great to play around with, but if you really need a medical diagnosis, especially skin cancer, the state of the art is not there. These apps cannot diagnose skin cancer. Somebody dies of skin cancer every 30 minutes in this country. So if you're worried about a spot, go to a dermatologist's office and have a look.
Your Knight score would be, drum roll please.
I think that this is going to develop into something cool, but we're not there yet. I'm going to give this 2 out of 5 diamonds, and we'll wait and see how this goes.
All right. Thank you, friend. Always enjoy you, Dr. Knight.